Hi, this is Julia from the Clarity Clinic in Hanover. Today I wanted to talk a little bit about what sets play therapy apart here at the Clarity Clinic. And I would say the biggest part that differs is maybe a little bit in who we have as our clinicians, but it's also in how we approach the work. So to start with, all of our play therapists here have a base training in working with general populations. So everyone here is either a registered psychotherapist or a social worker, so that they have that sort of base standard. And then in addition to that, they've done extensive training and research in working with children as a vulnerable population, which is above and beyond what it requires to work with adults and teens. So from that perspective, all of our team members here are highly trained clinicians to be able to work with your kiddos. The other piece that I think really sets us apart here at the Clarity Clinic is how we track or measure the work that's happening with your kiddos. So we use something called a Strengths and Difficulties Questionnaire. It's called an SDQ. This is an assessment piece that I know that some child psychologists in the area and the pediatric clinic in the area utilize as an assessment tool. We don't use it as an assessment tool here. Our work is really about progress and change. So we use it as a tracking tool. So when any kiddos start their work here at the Clarity Clinic, we have parents or other caregivers, teachers, and sometimes even the child themselves, if they're over 12, to complete the SDQ, Strength and Difficulty Questionnaire. That gives us a baseline or really a good starting point. And then we redo that assessment after every 6 sessions that the child has. So that gives us an opportunity to really sit down and look at what's shifting and changing for the kiddo in the play space based on the work that they've been doing. And that's a place where parents and the clinician can really talk to some of that behind the scenes stuff that the kiddo's not even aware is shifting as a result of the work they're doing. The different levels or the different sort of areas that this assessment looks at. The first is about strengths. So being called the strengths and difficulties, the work that we're doing is really highlighting the strengths in the kiddos. So their strengths is the first piece. And once they start doing this work, we start to see their strengths, their confidence, their independence really start to bloom. But typically, parents are bringing their kiddos here because there's a variety of difficulties. So the difficulty scales that we look at involve an emotional scale, so anxiety and depression, involve oppositional or behavioral scales, so for conduct and oppositional behaviors. There is an attention scale for concentration and hyperactivity. And then there's a peer and social scale. So how do they get along with others? So those are the 4 main scales that kiddos have difficulties with. So we're tracking those right from the beginning and throughout their treatment with us to be able to monitor what's happening underneath for the kiddo. And then that's how we as the adults can talk about really what's happening in the playroom. So I think I just wanted to share a little bit about what we do here at the clinic that really is the underlying piece that supports the work that is happening with your kiddo. Above and beyond the SDQ, there are some additional assessments that would be available. Please feel free to speak to your child's specific clinician about different options or opportunities that may feel like a good fit for them. Okay, thank you.